All right, for our 20-year service award winners, their manager will come up with them and say a few words. Michelle Abels, accounting.
Hello, hello. Michelle's been with the hospital for 20 years. She's been with me
16.
about 16, I suppose, in the spring. You know, everybody's going to talk about their 20-year employees being dependable. Michelle comes to work one morning and takes a bad step, lands poorly on concrete, and at 8 o'clock in the morning, she's sitting at her desk bleeding profusely.
I did.
Finally talked her into getting to the ER, and she was worried about her work. Here recently, we've had a brand new system come into place. She's been doing the same thing for 13 years or so. And so for the past month, we jerked all that out from under her and started over. And she's just been wonderful.
Well, thank you. Thank you.
She's coming along with all of it. Couldn't ask for anything better. Enjoy working with you.
And Bob, the great boss.
Thank you, Bob. Jennifer Bass, surgery. Kathy.
Jennifer came to KDMC in October of 1995, and I didn't know this till this week, but she actually started working in as a patient financial service person in the ER. She also worked as a registration clerk and a financial counselor. And she went back to school, and she became a cardiopulmonary technician. And she worked in that department as the secretary and as a therapist. And then in October of 2011, she transferred to surgery and has worked as a PACU nurse and a pre-op teacher and a admissions nurse. And right now she's training to be a circulator in the OR. So she's very versatile. I asked some of her coworkers how would they describe her, and the one that impressed me the most, well, they all impressed me, but one of the nurses said, she's our MVP. And I said, our MVP? And they said, yes, she can do just about anything, and she doesn't complain, and she does what you ask her to do. So we want to thank her for all these years of service. She's married, and she adores her nephews. And thank you, Jennifer.
Thank you.
Venice Brooks, case management.
Alvin stole most of my thunder, Dennis, you know. He's already told about your heart attack. But it's not all of our ER nurses that die there and get to come back to work. So we really, really appreciate you and all that you bring to the ER. You are a great ER nurse. You're a great case manager. You have very brilliant children and a lovely wife for much longer than you've been with us. So I thank you for everything you do every day.
Thank you.
Deborah Dunaway, third floor nursing. Jamie.
Well, Deborah started in 1995, September of 1995. When I came to King's Daughters in 2006, I had about a year and a half, 2 years worth of nursing at university in Jackson, but I was still kind of green, and Deborah kind of took me under her wing and really showed me a lot. She was a hard worker, a great ICU nurse, and she kind of like groomed us all. There's been several of the ICU nurses that she has trained, and she's just a true backbone to that unit, and we really appreciate everything she's done for us.
I did skip Danette. She is here tonight. And so Danette Brown in Laboratory Services, come on up, Danette. And I apologize for skipping over your name. Emma was sitting over there going, "Phew, I don't have to get up there and talk about her after all."
Because I love speaking in public. Danette actually came to us in 1995 as a new grad from the University of Mississippi Medical Center. When Danette first got here, I wasn't her manager, I was her chief tech. So I was responsible for teaching Danette everything that she had to learn and everything she had to do. And every day I would ask Danette a question, and she would always say to me, "I don't have any idea." And then, and one day we had a really busy day, and I said to Danette, "Don't say to me when I ask you a question, please don't say I don't have any ideas. Say, I don't know at this time, but I will think about it and research it, and I'll get back to you." And to this day, 21 years later, if I ask Danette a question, I can see the smile come across her face, because she's gonna say to me, "I don't know at this time, but I'll research it and I'll get back to you." And I asked Danette's coworkers about her, and one of the things they said was that she had a great passion for the work that she do, and she always give 100%. And that is so evident because Danette is our microbiology supervisor. And Dr. Connor, for some reason, loved micro, and he always come in the lab. And when Dr. Britt and I see him coming, our first thought is Danette here? And so when Dr. Connor asked me a question, my answer to him is, "I don't know at this time, but I'll research it and I'll get back to you." And my research is to run and call Danette and say, "Danette, here's Dr. Connor, what do I do?" So Danette, I love you, and I am so happy to be a part of making you the tech that you are, and I pray that you stay with us and don't leave. Thank you.
Becky Favi, Nursing Administration.
I could talk a long time about Becky, but he said to keep it quick, so I'm gonna try to. She started at King's Daughters Medical Center in September of 1995. I believe she was a new nurse at that time, but she had been working prior to going to nursing school. She worked in a factory, and then she decided to go back to school, and she came to us. She worked on telemetry for a good long while. She was interested in wound care, and we talked about her doing some wound care, and she started doing it. And I said, "Okay, you gotta go take this class." And she said, "Oh no, I don't do classes." And I said, "Well, I'll go with you. We'll do it together." And so we did, and she became wound care certified, and she was so inspired, she went on back to school and got her BSN. Becky has a wonderful son and a wonderful daughter, but even better than that, she has 2 grandsons and a granddaughter, and they are the light of her life. Thank you.
Gail Gray, Surgery.
Gail came to work for King's Daughters in January of 1995, and she had worked there 2 previous times. And Dr. Carner used to like to joke and say that she was on the revolving door plan. But she's quick to tell you that he was always glad to see her come back through that door. And so was I, because she was trained. It was just like, get on in here, Gail, let's get to work. But she's always done a great job for us. She's worked as a scrub nurse, a circulating nurse, recovery room nurse, and right now she's mainly in the role of a pre-op educator. And that is a very busy job. They get patients that have 40 meds that they have to reconcile, and it's very time consuming, and she does a fabulous job at that. She's married to Ricky Gray. She has a son named John and a daughter named Mary Catherine. So I asked her coworkers to tell me a word that describes her. And this is what they said. She was dedicated, caring, feisty, knowledgeable, and one of a kind. Thank you, Gail.
She's just going to stay here. Tanya Merrill. Oh, I'm sorry. Whoop. Is that right? Yeah. Tanya Merrill. I need dotted lines. Any other dotted line?
Tanya also started in January of 1995, and she's worked on medical and in the ER, and she transferred to surgery in 1997, and she's worked as a circulating nurse and a PACU nurse. She's married to Scott Merrill, and she has 2 sons, Andrew and Alex, and I asked her coworkers to describe her. The first thing that they told me was, "Oh, you mean two-wheel Tanya?" I said, "Two-wheel Tanya?" They said, "There's not a quicker nurse back here to get a room turned over and get the next case going." So that's a compliment. They also said she's hardworking, thorough, and empathetic. And also, Tanya's our new charge nurse for our new endoscopy suites. So we're tickled that she's doing that for us. And thank you very much. I love you.
Bob Metier.
Come on up, Bob. When folks realized that Bob's 20th was coming up, and we'd be able
There's a
to
microphone right here.
and we'd be able to talk a little bit about Bob, my phone was ringing off the hook about stories for Bob, and I said no, I've got just a few things I want to say, and then we'll move it along because we need to be quick. So Bob, I've got a few things here that I've done in order to be able to share with you some of the things. No, I'm not going to do that to Bob. Listen, he's my right-hand guy. I can't do that to Bob, okay? He started May the 1st, 1995, and at King's Daughters Medical Center. I guess started as the controller there. And his past hospital work, he'd been at the Bowling Green Hospital in Mandeville, Louisiana. He had worked at the Bolivar County Hospital over in Cleveland, Mississippi as a CFO, at Rankin General Hospital at Brandon, Mississippi, and I believe he had been the controller there, the information systems director, and the CFO. So I don't know if Carl's here or not, but we might can get rid of 1 or 2 FTEs the way I'm seeing this. Other work too, Bob is also used to do some tax work, and he wanted me to tell all of you to bring his taxes to him, that he has open. Is that right, Bob? Okay, excuse me. Bob has a BS in accounting from Southern Mississippi, Southern University, and he's got his master's from there as well. He's a CPA, and Bob's married with 2 grown children and 2 grandchildren. Like I said, 4 grandchildren. And, you know, if you want to see a soft side of Bob, if you can get him to talk about his grandkids.
I got pictures.
He got pictures. You'll see a soft side of Bob. But in all seriousness, Bob, his experience and what he brings to the organization is just, you can't measure that. And that is something that you just get from being there years and years. And so Bob, his experience, his knowledge of accounting, his ability to come in and take an issue and strip it down, decipher it, determine what needs to be done, and take care of that is amazing. He's, I have to say Meditech, and if there's Meditech, you go to 2 people for Meditech. You go to Kevin or you go to who? You go to Bob for Meditech. His support of the department, his own department, and then administration in general is superb. He's always willing to help, and so he's a valuable asset to our organization. And I want to thank him for 20 years. I've only been 6 going on 7, but maybe he'll hang around another 10 or 15. So congratulations, Bob.
He read that whole list. I mean, I was fixing to yank him over here. Emma Rufus, Nursing Administration.
Emma, we look really good together. Thank you. I'm wanting to congratulate Emma for her 20 years of service at King's Daughters, but it's really been about 30, hadn't it, Emma? Yes. She had a 10 years experience and left for a little hiatus, and then she came back, and she's been with us for 20 years. She has years of experience as a registered nurse. She worked a long time on the night shift on medical, and that's what she was doing when I came about 15 years ago. And then she came to me one morning and said, you know, I think I want to work in the daytime. I said, well, how can I say no? You've been on nights for like 10 or more years. Okay, come to the daytime. And she did that for a couple of years, and then she came to me one day and she said, I think I'd like to see about that case management position you have open. And I said, well, you certainly have got everything it takes to be a case manager. You're a wonderful nurse. Emma was such a good nurse that her patients used to bring her presents after they had been discharged. And I most remember the gentleman that brought me a package of frozen catfish wrapped in tinfoil and told me it was to go to no one except Emma Rufus. So she's been a case manager now for several years and recently accepted the position as our ACO care coordinator. And that's a brand new field, and you're a brave woman for jumping in there, Emma, because I know that we're all going to have our hands full with it. But I have every confidence that you can do it. And I also want to say that Dr. Carner misses you really bad. Thank you for being with us 20 years, and I hope we get some more out of you.
Dale Thompson, Radiology.
Dale started to work at King's Daughters in December of 1996 as a PRN rad tech. He's married to Kim, and they have 2 daughters, Madison and Neely. When he's not working here, he may be working at one of his other many PRN jobs. He works at St. Dominic's as a PRN rad tech. He has a grass cutting business. Oh, and the list just goes on as all the jobs that he does. His hobbies when not working consist of watching his oldest play softball at our travel ball. He's an avid NASCAR fan and loves to go to the races, especially Talladega. He also enjoys going to Chicago and watching the Bears play in the snow. When I asked his coworkers to describe him in one word, this is what I got: friendly, witty, a workaholic, outgoing, talkative, hardworking, but the best one, he's a scrubbing bubble. Because we know he can always get the job done. And I hope I have another 20 years to work with you. I have enjoyed the last 20 years.
Lynn Travis with cardiopulmonary. I think Lynn's with us tonight. So let's give our 20-year service award winners a hand.